Hi, my name's Dr. Brandon Erickson. I grew up here in the Sacramento area, and I have been practicing dentistry for about 15 years now. When I was 19 years old, I had the opportunity to live in South America for a couple of years, and one of the reasons I went into dentistry is because I had met a lot of people who were just really good to me. They took really good care of me, and I wanted, when I was in college years later, I decided that I wanted to learn a skill to be able to go back to places like South America and Africa and around the world to help people who needed a little more access to something. I didn't know what it was. And the more I thought about it, the more I turned to dentistry. And the more I started thinking about dentistry, I love the science aspect behind it. I love the entrepreneurial aspect. And most of all, I love the service aspect and the ability to help people. And that inspiration led me to apply to dental school and go through all the training and to become a dentist. And since then, I've had the opportunity to do quite a bit of traveling and a lot of humanitarian work. I've been lucky enough to practice dentistry in 11 countries, and it's one of the things I'm very proud of that I've been able to do in my life. Upon graduation from dental school, I had a unique opportunity the first patient I ever saw outside of dental school was actually in Bolivia. I had a friend who was doing a humanitarian trip. Before I even had my license here to practice in California, they needed some help down there. I'm fluent in Spanish, and so going down to Bolivia made a lot of sense. And I remember we pulled in this small village called Huancuyo in the floodplains of Lake Titicaca, and we didn't plan on setting up a clinic that day, but before we even got started, a bunch of people showed up in the little area we were. So we set up some dental chairs, and I remember sitting down and looking at the very first patient who had broken off his 4 front teeth. And for a moment I panicked, because this was the first time I had ever been able to practice dentistry outside of the school setting. But I stepped back, I took a breath, and realized I've been trained for this. I know what I'm doing, and that's how my dental career began. It all started from there, and it's been an awesome experience ever since. Our office is unique in that we offer quite a few services. There's a few things that we refer out, but for the most part, we can treat just about anything the patient needs here in our office. We do all the basic stuff, fillings, crowns, bridges, but we can also do some of the complicated extractions that a lot of other dentists would refer out. We do quite a few implants and implant dentistry. It's an awesome service for patients to be able to replace one missing tooth to an entire arch of missing teeth. One of the unique things about our practice is, I would say, our staff. We have amazing staff who care quite a bit about each and every patient. They tend to learn the patients by name. They tend to know who they are, what they do, and there's a personal touch to it. But I also think the skill of our assistants, of our dentists, of everything we have is top notch. I think that we provide a really, really good, high quality service, and we can do it with a very caring eye towards who the patient is and what their desires are and what their wants are. The goal with each patient is to do, it's probably not the best business choice, but to do the least amount of dentistry possible to make you healthy and function and have the aesthetics that you desire. We want to make sure, number one, that everything is as healthy as it needs to be, because we want you to be able to chew for a long time. Number two, we want it to function the right way. We want to make sure that you are able to chew and eat and talk and do the things that your mouth is intended to do. But three, we want you to smile. We want you to know that you can smile at people with confidence and show them that. Anxiety is a tricky thing in dentistry. Through my experience, I worked in a pediatric office for about 10 years and had the opportunity to see a lot of kids with anxiety. But I feel like anxiety is often something that has been created through bad experiences. Our first goal with anxiety is to attempt to give you good experiences, gain your trust, help you feel confident in our abilities and what we can do. But for some people, that's not enough, and it's understandable. Some people are terrified of the dentist, and I get it. So we have sedation options for you. We can offer conscious sedation with some medicine. We can have you just relax a little bit more and often forget the entire appointment happened while we get our stuff done. New technology in dentistry has been an exciting and growing field recently. There's a lot of new stuff coming out. We have the opportunity to have a lot of it incorporated into our practice. We have something called an iTero scanner that often, instead of impressions, we can use a scanner that will take a video of your mouth and we can send that to the lab for crowns, for Invisalign, for a lot of things like that. One of the other things, probably one of my favorites, is we have something called a CBCT, a cone beam scan, where if we're placing an implant, we can do a 3D x-ray of your head, and we can go to our computer and pick the exact implant, the size, the placement, and before we ever touch you, we have most of the decisions already made about how your surgery is going to go. It takes a lot of the guesswork out of the procedures, it increases the success rate, and makes for a much better experience for both the patient and for the doctor, because we've already gone through the tough decisions. We've already figured out how much bone there is, how much length we have, how much height we have, and can make decisions based off that. I have a lot of really good experience of stories. A lot of them happened in other countries doing humanitarian trips, of someone showing up to our clinic wherever we're working, explaining that they've had this tooth hurting them for years and being able to take that tooth out and knowing that they're going home that night feeling better than they did that day, even though I just taken out a tooth. But I think one of my favorite experiences was when I worked in a pediatric office. I had a patient who was a young kid. He was missing his lateral incisors, the teeth right next to your front teeth. And so he went through braces, and I ended up moving away. I had been out in Santa Cruz and came up here, but I had promised him that when he was ready, I would learn how to do implants and be able to place them for him so that I could continue to be his dentist. Well, years down the road after I had left, he showed up at our practice up here, and I got a note from his orthodontist saying that he was complete with ortho and he was ready for placement of implants. And we were able to place the implants, we were able to restore him. His smile looks awesome. The procedures all went great, and it was really cool for me to be able to start seeing him as a kid, and he's a young adult now doing awesome things, and it's been a really, really fun experience to get to not only have the skill set to be able to treat him from when he was little to these more complicated procedures, but to get to watch him grow up. My name's Dr. Brandon Erickson. We are here at Pebble Beach Dental in Fair Oaks, California, and we would love to get to take care of each and every one of you.